Adorucin. Detailed information about the drug and important precautions. Adorucin is a chemotherapy drug that belongs to the anthracycline group, used in cancer treatment. The drug works by inhibiting the growth and reproduction of cancer cells by interfering with the cell cycle. 1 Indications: breast cancer. Adorucin can be used alone or in combination with other chemotherapy drugs to treat metastatic breast cancer or early-stage breast cancer. Lung cancer. Adorucin can be used in the treatment of small cell lung cancer and non-small cell lung cancer. 1 Indications: leukemia. Adorucin can be used in the treatment of acute leukemia. Ovarian cancer. Adorucin can be used in the treatment of metastatic ovarian cancer. Stomach cancer. Adorucin can be used in the treatment of metastatic stomach cancer. 1 Indications: prostate cancer. Adorucin can be used in the treatment of hormone-refractory prostate cancer. Other cancers. Adorucin can also be used in the treatment of other cancers such as liver cancer, bladder cancer, kidney cancer, pancreatic cancer, and thyroid cancer. 2 Contraindications: prior treatment with other cytotoxic drugs or radiation. Using Adorucin after being treated with other cytotoxic drugs or radiation can increase the risk of toxicity. 2 Contraindications: prior treatment with maximum cumulative dose of doxorubicin or other anthracyclines like daunorubicin, epirubicin, idarubicin, and anthracene-diones. Using Adorucin after being treated with the maximum cumulative dose of doxorubicin or other anthracyclines can increase the risk of heart toxicity. 2 Contraindications: systemic infection. Adorucin can weaken the immune system, increasing the risk of infection. 2 Contraindications: severe liver failure. The liver is the organ that eliminates adorucin. Severe liver failure can decrease the ability to eliminate the drug, leading to drug accumulation in the body and increasing the risk of toxicity. 2 Contraindications: heart failure, severe arrhythmia, previous myocardial infarction, acute inflammatory heart disease. Adorucin can cause heart toxicity, exacerbating heart problems. Increased bleeding tendency. Adorucin can decrease the number of platelets in the blood, increasing the risk of bleeding. 2 Contraindications: breastfeeding. Adorucin can be excreted in breast milk, which may harm the infant. 3 Contraindications: when using Adorucin by bladder root tumors infiltrating the bladder. Adorucin can worsen the condition. Cystitis. Adorucin can irritate the bladder, exacerbating inflammation. Hematuria. Adorucin can increase the risk of hematuria. 3 Contraindications: when using Adorucin by bladder root difficulty placing a urinary catheter. Adorucin can irritate the bladder, making it difficult to place a catheter. Breastfeeding. Adorucin can be excreted in breast milk, which may harm the infant. 3 Contraindications: when using Adorucin by bladder root urinary tract infection. Adorucin can decrease the ability to fight infections, increasing the risk of urinary tract infections. 3 Contraindications: when using Adorucin by bladder root AIDS-related Kaposi's sarcoma. Patients effectively treated with topical or systemic alpha interferon therapy. Adorucin can reduce the effectiveness of alpha interferon therapy. 4 Adorucin drug interactions. Bone marrow suppressants. Adorucin can decrease the number of blood cells when combined with bone marrow suppressants. It can exacerbate this condition. Drugs with hepatotoxicity. Adorucin can cause hepatotoxicity when combined with drugs with hepatotoxicity. It can increase the risk of toxicity. 4 Adorucin drug interactions. Cyclosporin. Adorucin can increase the concentration of cyclosporin in the blood, increasing the risk of cyclosporin toxicity. Digoxin. Adorucin can decrease the effectiveness of digoxin. 4 Adorucin drug interactions. Do not co-administer doxorubicin with alkaline solutions or heparin. This can decrease the effectiveness of Adorucin. 5 Precautions. Use Adorucin as directed by your doctor. Inform your doctor about any medical conditions you may have. Inform your doctor about any medications you are taking, including prescription and non-prescription drugs. 5 Precautions. Keep your regular appointments for follow-up to monitor your condition and drug side effects. 6 Side effects. Common side effects: nausea, vomiting, diarrhea, fatigue, hair loss, decreased white blood cells, decreased platelets. Serious side effects: heart failure, liver toxicity, infection, bleeding. 7 Additional information. Adorucin can affect your fertility. Adorucin can affect your ability to concentrate and drive. 8. Storage. Store Adorucin at room temperature, away from light and moisture. Keep Adorucin out of reach of children. Note this information is for reference only. Always consult your doctor before using any medication. Additional information: the use of Adorucin should be carefully monitored by a healthcare professional, and it is important to discuss all potential risks and benefits with your doctor. Adorucin can be given intravenously into a vein, or in some cases, it can be given directly into the bladder. Additional information: the dosage and duration of treatment with Adorucin will vary depending on the type of cancer being treated, the patient's overall health, and other factors. It is important to follow your doctor's instructions carefully and to keep all appointments for follow-up care. Additional information: if you experience any side effects from Adorucin, it is important to report them to your doctor immediately.